Okay, well, I guess we'll go ahead and get started. Welcome, everyone. Thank you for attending the first Throwing Bones Cancer Active Education panel. My name is Kenny Capps, and I am the Executive Director for Throwing Bones. Our mission is to encourage and inspire, educate and enable individuals living with blood cancers to live their best quality of life through healthy and active lifestyles, with our ultimate goal being to see purposeful movement be an accepted and celebrated part of therapy for people living with blood cancer. Our moderator today is the Clinical Oncology Program Director at UNC Lineberger, Carly Bailey. She had Cancer Research and Treatment Center at the University of North Carolina, Chapel Hill. She is the Physical Activity and Wellness Coordinator at the Cancer Center. And today, she's going to guide us through our 4 topics and your questions. Those 4 topics, at least our goals for this hour, are to list benefits of exercise as a form of cancer therapy, to discuss dangers and risks for someone living with a blood cancer in starting a new fitness program as a form of therapy, to outline the steps to getting started in a fitness program, and to explore current collaboration of healthcare professionals serving individuals with blood cancer and opportunities for improvement. Carly?
Hello, everybody. Welcome. Glad you're here today. So each panelist is going to have about 8 minutes to answer these questions, and we're going to start with Dr. Saad Usmani. He is a hematologist oncologist at Levine Cancer Center in Charlotte. So Dr. Usmani, you can go ahead.
Thank you so much, Carly. It's a pleasure being here with this panel, and I want to thank Throwing Bones and Kenny specifically for putting this program together. I think this is a very timely initiative, and I'm hoping that we can reach out to more people to get this message across. Many of this is kind of commonsensical, but I'm going to try to make each of my answers quite brief, and this way we can have a good engagement during the question and answer portion of this program. In terms of benefits of exercise as a form of cancer therapy, I think in general what we recognize as cancer physicians is that when people are more active, they have better ability to tolerate the therapies that they're getting and also deal with the side effects of those therapies in a better fashion. And to put this in a more scientific manner, this has been looked at objectively with what kind of performance status grading patients are coming in when they're diagnosed. And what we've recognized over the past 60 years of cancer research in clinical trials is the better the patient's performance status at the time of diagnosis, the better their outcomes are. And this is regardless of age. We're not talking about young people, even in the older folks, patients, cancer patients who are over the age of 70 or 75, the better performance status they have, the more active they have, that actually helps in you during the care of your cancer. And so, that's kind of a general answer for that question 1. And then the second question is to discuss the dangers and risks for someone living with blood cancers and starting a new fitness program as a form of therapy. I see more positives than negatives in general, but I do want to highlight the fact that most patients who have blood cancer have a weak immune system to begin with. So the kind of exercise or fitness programs you pick is going to be determined in part by that. The other important piece is depending on the kind of blood cancer you have, there are certain ones like multiple myeloma where the bones can be severely affected. People can have bone fractures, and that can put a limitation on what you can and cannot do in your fitness program. So, there are always these pros and cons that you have to, judge by, for someone who has had significant vertebral compression fractures, so fractures to the spine bones, you're not going to go and bench press 500 pounds. And you're going to recognize that you may be putting too much power for your chassis and kind of back off a little bit and make this plan a little bit more individualized. The third point, outline the steps to getting started in a fitness program as a form of therapy. I think the first step is the recognition that, hey, I've got to incorporate this in part of my treatment game plan. I have to start increasing incorporating exercise into my daily routine, making healthy choices in life, and trying to, move in that direction. I think that's the first step. And then, different cancer centers have resources available. Carly is probably going to highlight things a little bit about it, and Kenny can perhaps, mention some of the things he learned from our cancer center supportive care colleagues as well. And then the last point, explore current collaborations of healthcare professionals serving individuals with blood cancers and opportunity for improvement. I think this is a big area of need right now. Different blood cancers have different median age of diagnosis, so it's going to be a different conversation with different groups of patients, have different disease subsets. But, it doesn't matter if it's on the healthcare provider side or the patient side. I think there's a clear recognition that there is an opportunity to improve these kind of collaborations. And again, kudos to Kenny for getting this spotlight on this particular issue. And I'll stop here and hand it over back to Carly.
Thanks, Dr. Usmani. I have a couple of follow-up questions for you. The first is, you spent some time talking about performance status. Can you define performance status and also talk about what things you use as a clinician that help you measure performance status?
So, the most common performance status tools we use, there are two scales. One is called ECOG or Zubrod performance status, and the other one is called the Karnofsky performance score. And the ECOG or Zubrod performance status goes from 0 to 4. And the Karnofsky performance status score goes from 100 to 0, with 0 being the best that a person can be on the ECOG score, and 100 being the best on the Karnofsky scoring scale. And essentially, we're looking at both activities of daily life and independent activities of daily life, along with how much time do patients actually spend on their feet, off the bed, essentially. So that's the most important, I guess, benchmark. It's a very common question we would ask. How much time do you spend, sleeping and on your feet? So if a patient is spending more than 50% of their time in bed in a day, that's not good. Just as an example, and I can certainly, Carly, you and I can take a really deep dive and just keep on talking about the performance status question in general, but that's my general answer.
Awesome. Thank you so much, Dr. Usmani. Appreciate your answers to those questions. For the attendees, as you are coming up with questions in real time as our panelists are speaking, please feel free to go ahead and enter them into the Q&A section. We are going to use those questions during our discussion time after all of the panelists have answered the questions. So next, we have Dr. Sandy Eskew Capps. She is a physical therapist. She does a lot of work with geriatric and post-acute rehab. We're glad to have her, so go ahead and take it away.
Thank you, Carly, and I also thank you to Throwing Bones, Kenny, and his team, and the entire panel. It's an honor to be part. This was one of those conversations that Kenny and I were having where I said it would be great if you had a physical therapist to participate. So here I am. And without knowing the background and experiences of the attendees, I wanted to start by providing kind of a high-level overview and some background, and then go through each of the objective topics. So when you talk about cancer, survival is an interesting concept. It's been defined as the time from diagnosis to the length of time a person remains alive. So I think sometimes we kind of have this idea in the lay community that there's some box that you put the definition of survival in. So there's no specified time frame. And I think when you think about survival and the way that we frame, I'm a big word person. I'm a hair splitter when it comes to words. So I think it matters the words that we use. So when we talk about living with or having a diagnosis, I think that kind of plants a seed, and we can choose how we frame that. So talking with patients and individuals with cancer, our choice of words impacts their outlook and motivation. We can contribute to that. A diagnosis of cancer for me as a physical therapist working with geriatric population, this is huge. It doesn't happen in a vacuum. So I teach pathology to tech college and undergrad and graduate students, and we separate out the topic of oncology or cancer. Well, it doesn't happen in a vacuum. It occurs in a living biological system, a human. And so all of the physiological processes, all of the risks, possibly undiagnosed comorbid or other existing conditions are also present. And we could be very obviously talking about things like heart disease, Parkinson's disease, cognitive impairment, neuropathy, etc., any other condition. COVID-19, for example, you know, everything is still there, everything that was there before when somebody is diagnosed with cancer. So the profession of PT offers a specialist certification in oncology. It's a national board process. It's a very involved process. I do not have my oncology certification. It was interesting to me when I started looking into this to go look at what I found is as of the fall of 2019, there are fewer than 100 board certified oncology physical therapy specialists in the country. And so I did a little bit deeper dive and I looked at, I wonder how many there are within 100 miles of, say, Baltimore. Think Johns Hopkins. There are two within 100 miles of Johns Hopkins. So we're new coming into, let's look at this as a practice area for physical therapists. And there was an exam that took place last fall. So hopefully we have more than 68 is what I counted if I looked correctly at the figures. So interest in this practice is increasing in physical therapy because the number of patients living with cancer and surviving cancer is huge. There are, I think, 45 million cancer survivors around the world, over 15 million in the United States at this time. So when I was in PTA school in 1970s, we had a paragraph on the pathology of multiple myeloma because it wasn't something that we needed to be concerned with. And now Kenny just actually came and did a guest lecture for a group of learners on the topic, talking about his experience and helping people reframe, you know, it's a diagnosis. It's not a limitation necessarily on living, on life. And I think he has kind of proven that. So the good news is that entry-level education for physical therapists and physical therapist assistants includes now some basic information. So every physical therapist that you might see has some background or should bring themselves up to current practice in terms of what the expectations are. We need to know about cancer and understand it. I will tell you that, and Carly, I don't know if you got that infographic that I sent. You could pop that up there because this is what we know in terms of the benefits of exercise. There's evidence, most of you have probably heard this, that exercise lowers the risk. It's proven. There's evidence, strong evidence that shows it lowers the risk of 7 types of common cancer. And that's on the infographic that Carly's pulling up. Exercise, as Dr. Usmani said, has benefits related to the side effects of treatment for cancer. And we talk a little bit more about that. And also certain quality of life measures that are used. You know, it's not just necessarily how strong are you, or how far can you run. For example, there's quality of life measures that are vitally important as well. And then there's new information published as recently as November of 2019. It shows there's substantial evidence to suggest that exercise is improved this is new and really important. It's associated exercise with improved cancer-specific survival in patients with breast, colon, and prostate cancer. So we didn't know that for sure. I was reading a lot of articles and noticed that they were saying the evidence doesn't show for sure. This is the important thing. It doesn't show for sure that exercise has an impact on the cancer diagnosis itself. Well, now it does. And so that's brand new as of, last fall, that it shows there's evidence that it relates to cancer-specific survival in those types of cancer. Other than effects on the cancer diagnosis itself, there's good evidence, strong evidence that shows it has exercise prescription has positive effects on cancer-related health outcomes related to fatigue. I mentioned quality of life, physical function, decreasing anxiety, decreasing depression. And for those outcomes, there's strong evidence that exercise has a positive effect. Also, evidence shows that exercise is safe for patients with lymphedema, which can be a debilitating and disabling condition that results not necessarily from the cancer, but from the treatment of cancer. We know enough about adherence to home programs to know that we improperly dose exercise, so we should not pretend or go through the motions. This is kind of leading into dangers, risks, and how do we start an exercise program for someone with a cancer-related diagnosis. Dangers and risks, I mentioned comorbidities. Infection control, Dr. Usmani, again, he mentioned compromised immunity. So especially now, we need to attend to infection control. We all learn it. Sometimes we get slack in some settings more than others. Issues also, Dr. Usmani mentioned, fractures, skin damage. Sometimes medications or treatments such as radiation cause skin compromise. I mentioned lymphedema. We also need to monitor physiologic responses. And well, my time's up, but I have some more information about steps to begin a fitness program too. So when we get a little bit more into it, I can go through those.
That's okay. Sandy, why don't you go ahead and finish your thoughts?
Okay.
I just wanted to let you know that our time is up, but
okay.
Go ahead and finish up what you're saying.
Thank you. Sorry, Brianna. So steps to begin a program with your team. This might be your team. So with your team, you've got to have a team. We all know that. Determine who will oversee the completion of a comprehensive assessment. Just who will oversee it. That includes your health history, including pre-existing and past health issues, your goals related to exercise and overall health. A screen of all body systems that includes skin, gastrointestinal, urologic and renal, your fitness and baseline for exercise, endurance, flexibility, vital signs, balance and risk of falls. We're all at risk of falls. That has to be an inherent part of your program before you start. Screening of health indicators such as sleep, nutrition, health literacy, and self-efficacy. We do this without value judgment of the patient. We avoid terms and thoughts, biases such as the patient doesn't understand, the patient refuses, the patient's uncooperative or non-compliant. We need to turn our thoughts from those ideas. We screen for anxiety, depression, pain, social support in terms of living situation and environment. All of these can be overseen by a single provider. It doesn't mean that one provider does all of those screens. So that's critically important as well.
Thank you so much, Sandy. That's such great information, and we'll look forward to hearing more during our discussion time. So next up, we have Brianna Castrogiovanni. She is a clinical research coordinator and exercise physiologist at UNC Lineberger and Chapel Hill.
Thanks, Carly. So I just want to start out by talking about the initiative Exercise is Medicine. So the American College of Sports Medicine, the ACSM, which Sandy talked about a little bit, Exercise is Medicine is their global initiative to make physical activity assessment and promotion a standard in clinical care and really encourage physicians and other healthcare providers to include physical activity when designing their treatment plans for their patients and to refer their patients to evidence-based exercise programs and qualified exercise professionals. So the benefits of exercise for cancer therapy. So Sandy already talked a little bit about this. So last year, the American College of Sports Medicine, the American Cancer Society, and the National Cancer Institute, they sat down, they went through the research, and they found strong evidence, like Sandy was saying, that exercise decreases cancer-related fatigue, anxiety, depression, and it increases or has a positive effect on your health-related quality of life, your physical function. And there's some moderate evidence to show that it does have some positive effects on bone health and sleep as well. And so what kind of exercise exactly? So the guidelines suggest aerobic exercise 3 times a week for about 30 to 60 minutes per session at about moderate or vigorous intensity, and resistance training about 2 times per week, and really working those major muscle groups. So the research really does show that aerobic and resistance training together has the best benefit. And so what we know from the literature is that exercise makes a positive impact, in many different domains. And we believe that exercise is safe and, really has a positive effect on a patient's quality of life as well. And the biggest takeaway from, the research and what the American College of Sports Medicine kind of announced was just to avoid inactivity. And that's really the biggest take home. So the dangers and the risks to exercise with blood cancer. So Dr. Usmani kind of touched upon this a little bit too, but specific to blood cancers, you don't want to exercise if you have a fever. You want to make sure your platelet levels are, at an appropriate or safe level. And, myeloma patients that have lytic lesions, since they are at higher risk for fracture, it may be good to do exercise that's supervised, so with a professional, because if you are risk for falling, that could definitely be detrimental. And it is safe for patients that have lymphedema. You just want to make sure that you're wearing your sleeve. And so steps to getting started in a fitness program. So you always want to just check with your doctor. You want to find a qualified exercise professional. So how can you do this? You can go to the ACSM website and you can look in their Pro Finder and you can find a certified cancer professional. You can also check in with your local YMCA and see if they have a Live Strong program. And you can also check with your local hospital if they have a fitness center, and you can ask if they have any exercise professionals that work there as well. And so when you're working with an exercise professional, you want to make sure that, they're not only certified, but they have experience working with people with chronic disease. You also want to think about your goals, what your short-term goals are, your long-term goals are. You do want to do some sort of fitness testing to establish a baseline, and this way you can be able to accurately, manage your intensity and making sure that you're following an appropriate heart rate range for yourself. And you want to understand, the exercise safety as well. And you want to do something that you really enjoy doing. So if you really enjoy walking, maybe it would be fun to find a walking group. If you really want to work with a personal trainer, then maybe you want to find an exercise specialist with the appropriate experience. And so just to touch upon the research just a little bit, so there's a study in 2017 done at UNC, and it looked at the effects of exercise on symptoms and physical function in adults with acute leukemia. And what they found was reductions in symptoms, so anxiety, fatigue, depression, and sleep disturbances, and also improvements in physical and mental health scores as well. And then another study in 2018 done in Melbourne, Australia, looked at a hospital and a home-based exercise program to address functional decline in patients that had an allogenic stem cell transplant. And what they found was from pre to post intervention, there was significant improvements in functional capacity, and also their health-related quality of life improved significantly. And so interesting to note that the participants that didn't complete the study, that dropped out before the end, had significantly worse functional capacity at baseline. And so they didn't have any kind of intervention with them while they were before their transplant and while they were getting their transplant. So there may be some benefit in support and exercise guidance before and during transplant as well. And so that kind of leads me into talking a little bit about what we have at UNC right now. So at UNC currently we have a health coaching program, and it specifically targets blood cancer patients, but it's open to all types of cancer patients as well. And the main focus is engaging clinical teams with exercise professionals and with health coaches to deliver, an individualized exercise prescription and coaching for patients and survivors. And this can be at any point in their treatment. So when we look to enroll someone undergoing a bone marrow transplant, we try to get them into the program prior to their transplant, so that way they have the support and the exercise before and during their transplant. And what we really hope to find is improvements in physical function. We can identify, any unmet needs or any needs that the patient has. And, we hope to increase a patient's self-efficacy for their disease management, which will likely lead to better quality of life. And we hope that eventually this just becomes a standard of care. That's it.
Thanks so much, Bree. That was really great information. Appreciate it. So next up, we have Kenny Capps. He is the director and founder of Throwing Bones and also a cancer survivor. So Kenny, if you'll share a little bit about your experience.
Well, sure. So I guess I have to tell you, the other panelists have nailed just about every really cool thing that I probably was going to say. And they said it smarter with bigger words. So I think I probably should speak to this more from a patient's perspective as opposed to a coach or a fitness advocate. This is more, again, from how I see these things. So the benefits that I see, and from my background to cancer therapy, are to do the basic things and control high blood pressure, hypertension, and other ailments that otherwise might get in the way of proper treatment. We all know, or most of us know, that something like a bone marrow transplant is not exactly the easiest thing to go through, and certainly not a lot of fun. And some of the things that could really interfere with being able to effectively, or at least even be eligible for one of those, is your underlying health conditions. So otherwise, purposeful movement can certainly have an effect, and we all know this, to do those things, to control the high blood pressure, the hypertension, the obesity, diabetes, and so forth. Those things can adequately, positively affect you so that you can be otherwise eligible for something like a bone marrow transplant that could treat your blood cancer. But the other things that you can gather from exercise is pain management. As all of the panelists have mentioned, myeloma being one of them, is that it's known that bone involvement is a common occurrence. Personally, I had 2 compression fractures in my spine due to multiple myeloma. And so pain is just sort of part and parcel. And I know that some people who are watching this today have experienced the same things, and have maybe a reduction in their height even because of those compression fractures and so forth. And again, there's things in your arm, broken bones and so forth. It's a really common thing. Well, exercise and purposeful movement can actually increase your ability to tolerate that, through strength, mobility, flexibility, release of endorphins. It can help control fatigue. It can. Now, here's one of those things that Brianna brought up that I think is pretty awesome, that we actually talked about earlier, which I don't think it's a big leap. And again, I have to use small words. I'm the least qualified in the room. But I think that if it's known that purposeful movement, activity, healthy lifestyle can increase your or boost your immune system. And we all know about immunotherapy being a still somewhat new treatment option for cancer. Now we're getting past just the initial CAR T clinical trials, where just about every pharmaceutical company seems to have a CAR T lab. That it doesn't seem like a huge leap a leap to associate a boosted immune system and some form of immunotherapy. And again, small words, but it seems to me that that could be part of your effective treatment for your cancer. Because again, exercise, we know that it has the ability to boost those immune systems. The dangers and risks. So I guess since we're talking about degrees of activity, I don't personally see that there necessarily has to be a risk if done properly, with purposeful movement, with activity, increasing your activity levels, to be healthier and active, and also to make this, that activity as part of cancer therapy. Because if all you can do is get off the couch and go to the mailbox and back now, then that's your level, that's your tolerance level, that's your max capacity. Doesn't have to stay that way, but that's where you start. And so everything's relative, and what's considered active or extremely active, it's got to be relative. Whether you can, again, walk around the block or run 50 miles, again, it's depending on what you can do and what you can do now, and you have to start somewhere. So I would say the risk is minimal. You have to be smart. There's always a risk of overdoing it, but that's true again for that 50 miler or that one blocker. So I think that as far as the steps goes, and again, I know everybody's covered this, but I think that obvious one is to start with an assessment. And throwing bones right now, we've been delayed obviously because of everything that's been going on in the world in getting to these things, because we've gotten a little bit of funding to start a self-assessment tool to help cancer patients to at least start that assessment, so that they can start talking to somebody that can get them to that next level, so that they can determine where they're at. So again, you have to do a fitness assessment, testing your strength, your stretch, your mobility, your range of motion, your cardio. All of those things are important, and also being trauma aware. And I think that's why it's important. So Sandy talked about certification programs, so that people are, again, essentially they're being trauma aware. They're aware of the things that are going on with your body in order to help you get more healthy, more active. And so those are achievable. Those things, you can create goals, set those goals, fitness goals, healthy, active lifestyle goals, and achieve them. But you got to start somewhere and determine where you're at. So, and then I'll see. So, and I think that actually that leads to what I think all this needs to be about, is exploring the current collaboration of the healthcare professionals. This is an ideal situation for me. This group of people that are discussing things from the hematology all the way down to the physiological standpoint. I mean, that needs to be an entire conversation at diagnosis, in my opinion. And again, this is from a patient standpoint, not from any sort of healthcare professional standpoint. This is for an awareness that this needs to be addressed at the beginning. And so as soon as that diagnosis occurs, then we determine what next steps are. They're doing that. But one thing that sometimes seems to get left out is are we doing the whole thing? Are we discussing the entire thing? And that includes that healthy, active lifestyle component, and making that a part of your treatment program, right? So that conversation needs to be had in determining how do we incorporate that into your next steps. And one of them may be, go get a second opinion to determine your treatment situation, or a second opinion as to if the diagnosis is accurate. And then maybe then the next step is, let's take an assessment to determine your physical ability to get fitter, to get healthier, to respond to this, and a potential treatment options. So, and again, small words, trying to bring everybody into the fold. All right. Thank you.
Thanks so much, Kenny. And to all of our other panelists, we have gotten some really excellent questions during this. So we're going to move on to the question and answer side of things. So we've gotten quite a few questions about people with bone fractures and multiple myeloma and weight-bearing exercise, do we want to take a couple of minutes and answer that one? I'll let our panelists unmute and discuss at their own leisure.
This is Sandy. I'm going to jump in because I know Dr. Usmani and Brianna, I know all of you will have things to address, and Kenny mentioned the compression fractures. I think that could be an important, dependent on the nature of the type of cancer. Somebody asked specifically about multiple myeloma. Maybe a bone density test would be in order, and something that, of course, at a certain age should be part of our routine screening, because it is important to have that kind of baseline information. So for those of you who are listening in, if you haven't done your age appropriate screenings, it's good to have that baseline, because we never know, and it gives you a good starting point. So with certain pathologies, certain conditions like multiple myeloma, someone, I think it was Brianna, maybe mentioned the lytic cancers in the bone, osteolytic or lysis, which means destruction. And Kenny mentioned the compression fracture. So it's very similar. I know I'm oversimplifying. It's very similar to what happens with osteoporosis, is that the bone becomes, for lack of a better descriptor, kind of chalky and brittle. And so you are at greater risk for fractures. So I think it was Mike specifically asked about other exercises. Aquatics is an excellent choice. Activities like yoga with supervised, Brianna talked about the importance of having supervised exercises. If you are at risk of or have pre-existing conditions like that, you do far better by having guidance, at least to get you started. Don't accept somebody just giving you a piece of paper and saying to you, go home and do these things. But a pool exercise, stretching, absolutely. Careful stretching that you're taught to do by someone who knows what the risks are. And then activities such as yoga can really help you get the benefits of the exercise without increasing your risk of fractures due to the bone weakness.
I'm gonna go ahead and nailed it. I thought that was fantastic.
Yeah, that was excellent.
Yeah.
Does anybody else have anything to add to that answer, or anything else to expand on about exercising with bone lesions and what's safe and what's not? We had a few questions about examples of safe exercises when you have bone lesions. Does somebody want to weigh in on that?
Sure, I can. So I think that if you are working with an exercise professional, if you're in a supervised environment and you're working with an exercise professional, I think that there are some body weight exercises that you could probably do that would be safe. I think it's important to listen to, the person that you're working with, but things like sit to stands, where you're starting standing in front of a chair or a bench that's sturdy, and you're sitting down and you're standing up, something like that is definitely incredibly beneficial. And I would say anything, so that's one of the best things. If you can safely get up and down from the floor, there's plenty of exercises you can do, like, bridges, so bringing your hips up, and bird dogs, which is something that you do in yoga where you're really working and stabilizing your core. So I think there are a lot of just weight-bearing exercises that are definitely safe, but you definitely, if you're at an increased risk for fracture, you definitely want to make sure you're working with, a professional and you're in a supervised environment.
Thanks, Bree. Dr. Usmani, I assume that you're probably the best fit to answer this question. Is there any evidence that certain exercises can actually increase bone density and help slow down progression of plasma cells in multiple myeloma, for example?
So not specific to myeloma, but there is a wealth of data that stressing the bones with exercise and weight-bearing exercises specifically helps improve bone density. That wealth of data comes from postmenopausal osteoporosis setting. In addition to bisphosphonates, in addition to the studies that have been done looking at calcium and vitamin D supplementation. And even though the mechanism of how bone loss happens in myeloma is different, those principles still stand in play. I think, your bones do need a little bit of stress to actually start, forming and restructuring. So that's where, that data comes from. But I don't think that there is, any specific data, which shows us that the myeloma activity goes down. I think you're doing these exercises more for bone health, in this setting.
Yeah, and that stress that you're talking about to build bones, that can be strength training or cardio. Anything that is giving your bones impact. That makes a difference. And we also had some questions about how things like yoga and other maybe non-traditional types of exercise, when we think about, cardio and strength training, like how that affects your quality of life and bone health and experience with quality of life and things like that.
I think in general, I mean, those exercises are so good in instilling, patience and endurance, and they're good for all ages. I think, again, with, a lot of heme malignancies in older patients, the joints get stiff. I'm getting to an age where, I get weird sensations when I wake up in the morning and I don't know where, how the heck happened. I can only imagine it's going to, get worse over time. It's just a function of us getting old. And exercises like, yoga and Pilates, so what they do is they challenge the non-stretchy parts of your joints, and I think that's extremely important in the grand scheme of things, because it's not just the muscle that needs that kind of challenge. It's not just the bones that need the stress. It's our joints and parts of the tissue that don't get good blood supply and can stiffen up very easily over time. And so, exercises like Pilates and yoga actually help.
And also with the balance elements of exercises like yoga to assist with reducing a risk for falls. Like I said, we're all at risk for falls. The other thing that's so great about practices like yoga is the breathing is huge. It's huge for so many reasons. And then also the centering aspect. So the spiritual aspect and the, staying grounded and all of that. And of course, now there's so many flavors of yoga that don't necessarily incorporate all of those elements. But I didn't specifically mention this psycho-spiritual aspect. That's very, very important for all of us to address as well on some level with really every client, and the mind-body connection and just, finding that sense of grounding and peace, I think, is challenging if you're not dealing with a scary diagnosis. So something that we should incorporate.
Definitely. And what we know about exercise in general is that it doesn't really matter what you do, as long as you're doing something, that tends to make a big difference for most folks. We've gotten a lot of questions about specific types of exercise regimens, walking and disease specific. And I would like to sort of broadly answer that, and then definitely let the other panelists chime in. From my experience, it doesn't necessarily matter what you're doing, as long as you're doing something and your physician says that it's okay. I tend to recommend that people stay away from pools. I know that COVID has thrown a wrench in everybody's exercise plans. So, finding something that you can do either at home that your physician is saying is okay. I know there's tons of exercise and yoga videos online on YouTube offered for free. At UNC, we've moved all of our exercise programming to remote programming, which has been a great resource for our folks. And many of our programs are available for people outside of the UNC system. So if that's something that you're interested in, you can get in touch with me. But you have to start where you are and then slowly expand up. So you can't I can't just say, you know, if you have this diagnosis that you need to walk for 20 minutes a day, 5 times a week. It depends on where you are, which is that assessment piece that so many of our panelists talked about. So hopefully that answers those questions about specifics. I know it probably doesn't very well. Do any of the other panelists have something else to say about that?
No, that was pretty much perfect.
Yeah, and I think that the telehealth delivery model is available now from really all of our professions.
Definitely. And what about when it comes to having insurance cover exercise services? Can we talk about that for a few minutes?
I need to go first on this one again. I wrote in my notes that in terms of the collaboration, obviously the client is part of the interprofessional, if you will, team, an integral part of the team. I think we need to advocate and help our clients and patients advocate, even at a higher level, that we need policies, payment policies, regulations that insist that these services are paid for. And so a lot of payers won't pay for wellness and prevention offered by a physical therapist. That's true. That's current. We need to push the envelope and continue to bring it up. You call your payer if you're well enough, or ask your provider to call the payer and say, this should be paid for. It's not really even cost cutting or cost saving. It's avoiding costs. It's avoiding health risk costs. So if somebody has a fall, that could be prevented. We could avoid that cost altogether. So we need to keep getting that message out and helping our patients feel empowered to contact their payers and say, I think this should be paid for.
So for those who have Medicare and have a supplemental plan with their Medicare, there are a lot of fitness centers that cover Silver Sneakers or Silver and Fit. So my advice is to check with your insurance. If you have Medicare, check with them first and see if this is something that you're already paying for. And if it's not, then maybe it's something that you'd like to add to your plan. But the old hospital that I worked at had a fitness center, and they covered both Silver Sneakers and Silver and Fit. So you could get essentially a free membership to the fitness center, and there was exercise professionals working there. And so then you could sign up for different exercise classes that were supervised. You could also work with a certified exercise specialist as well. So definitely look into your local fitness centers and see if Silver Sneakers or Silver and Fit is a part of their gym.
Definitely. We are going to switch back in the direction of COVID for just a second. Have you guys seen any kind of guidance about when it is safe for cancer patients and survivors to get out there and start exercising in groups again with other people?
So I think we're still in phase 2 here in North Carolina. So, the current advice is, not to engage in public exercises. Having said that, there are a lot of online resources available. And this is something, Carly, where, most cancer centers, that we haven't focused on this, but perhaps we should. In creating, either video or remote contents for patients, and this is something that we can potentially work on together.
Thanks. And then the last question that we haven't quite covered yet is about exercise and the immune system. So how exercise affects the immune system, and also how that might help with immune treatments and fighting cancer. Don't all jump at once.
All right, I can take a general response here as well. So, I think that in general, you will not see a numerical change in your immune system markers when you're exercising. But there's certainly data that the quality of immune responses does improve with exercise. So when I say, that the numbers, if you're a myeloma patient and your lymphocyte count is generally low, or your total immunoglobulins or IgG levels are generally low because of the fact that you've got myeloma or you're receiving myeloma therapy, you may not see a jump in those numbers, but the quality of responses to you getting an infection and being able to fight that infection, it's going to be better compared to someone who's not exercising. So that there is data out there to that effect.
On that note, Saad, can I ask you a question that I feel confident you're the right one to ask, with relating to immune systems? And so currently I am on a maintenance therapy of Revlimid, 10 milligrams per day, 3 weeks on, 1 week off. But one of the things that seemed to have been a side effect, maybe, or a side benefit, I should say, of taking Revlimid is that I get very few colds or infections and so forth. And I've heard that actually is a common benefit from that drug. And could you sort of talk on why it is? It has nothing to do with, I guess, with necessarily my innate immune system, but it's actually the treatment I'm on. Is that right?
Yeah. So Revlimid helps increase certain immune cells' ability to fight infections. So it kind of, it sounds like a pun, but Revlimid can rev up the immune system. So it can rev up the T cell activity and the natural killer cell activity. And so, we don't consider drugs like Revlimid as immune suppressant, when it comes to myeloma. Patients in general, especially with the maintenance doses. Now, they can be immune suppressive or myelosuppressive at higher doses, and especially in combination with some other therapies like Velcade. But maintenance lenalidomide or Revlimid is not considered, immune suppressive. If anything, it kind of helps the immune system, which is different from drugs like Velcade or Darzalex, or steroids for that matter, which actually dial down the immune system.
Sure. So in your opinion, if with that would, I guess, the increased activity or boosting your immune system sort of in the natural way, could this only supplement or aid in a patient's ability to, be, I guess, prepared for other treatments as they come along?
Yeah, I responded by saying yes, but I was on mute, so sorry about that.
No worries.
All right, well, I think we have time for maybe one more question. And I wanna just point out that North Carolina is a big state, and there are lots of patients who are rural. And so what kinds of resources can we come up with in the next maybe 5 minutes to help with the rural population and how we can meet their needs?
So I think I'll take a stab at this, so we've got Kenny here. I think this is an opportunity for Throwing Bones to create programs, that patients can access to through the Throwing Bones website, and participate. And I'll let him take this away. He probably has tons of ideas. He's kind of the
And Kenny,
yeah,
Kenny, I'm sorry to interrupt you. Can you also talk about why you created Throwing Bones and
Sure.
how you got into this?
Yeah, no. I did see a gap as a sort of ineffectual and aging, I guess you could say, athlete. I did see that from my vantage point that there was a disconnect into talking about fitness or purposeful activity and treatment in cancer, in cancer treatment. It just wasn't discussed. And so as I went through my initial processes, especially the first year of some major stuff, I mean, again, leading up to a bone marrow transplant in 2015, I realized that actually wasn't part of the conversation. And I did hear, and as I met people, other patients along the way, they would tell me things like, well, my doctor told me that I can't do this, or my doctor says, well, I'm too old for this. And none of those really seemed to make sense to me. And so then I recognized that there was a gap within the healthcare industry in having that conversation from the get-go. And again, it's just sort of how it's set up. I don't think it's anybody's fault. I think it was entropy, but it needs to be discussed. And again, I think, and there needs to be that collaboration of this group of people to create a system where the purpose is to get I guess increase quality of life, but also to get the patient as healthy as they possibly can. And that's part of it. So that was the long, confusing way of answering your question as to why I started throwing bones. But as far as the sort of access, telehealth, telemedicine has to be, and again, which every panelist has mentioned, especially in this age of the pandemic right now, it has to be, we have to create these opportunities for people to connect just like this. We can't have this in a hotel room with 20 tables of 8 sitting around eating lunch and discussing this. So we're doing this online. But the benefit of it, side benefit is that we're able to connect with more people who can't fly to Asheville, North Carolina and come to a lunch meeting like this. They can do this right now. Same thing is true for someone who's trying to get healthier and more active and make that a part of their treatment program, is that they potentially can have that telehealth opportunity. And it really can be an opportunity, which I know that Bree, you and Carly are working on a system down in Chapel Hill to make that, and you're in the early stages still of that, but you're trying to make that a part of what it is that you do. And so you're really kind of analyzing what works, what doesn't work right now. And so throwing bones, again, at the beginning of this, I mentioned that we're talking about an assessment series, starting out as a self-assessment series that would lead to discussing with people that would be certified coaches or trainers to help you get to that next step. Again, working in conjunction with other healthcare professionals in order to get you to the point where they need you to be. And again, so you can set your goals, you can set your sights, and then make a plan in order to get that. And again, that can be done in this way. So Throwing Bones is hoping to set up not only the assessment series, but also a coaching network, associating with other personal trainers and coaches that are certified in, specifically to cancer patients, to help them get them to that next level. And then, of course, that'll lead to other things. It'll lead to more conversations like this, where we can determine what's working and what's not working. We can talk to healthcare professionals like that are on this panel to do this better. What's working, what's not working. And we can all come and coordinate. And then hopefully at the end of the day, we're going to have something to where we can go to that point of diagnosis and they say, here's this. So this is what you have. This is where we're at, where you're at. And this is the next steps. And one of those is that you need to go register on Throwing Bones and find out, or whatever it happens to be at the time. It doesn't have to be, this isn't about Throwing Bones. This is about the individuals getting healthy and more active. But at that point, then you can make a connection with that coach or trainer who can get you to that next level. So those are my big grandiose ideas for Throwing Bones. And we're working on them this year. And we have been delayed because of COVID and the pandemic. But we're adjusting too. And so I really want to say thank you before we get off here to the panelists and to everybody that's participating today. We had almost 100 people sign up for this today, and over 50% of you stayed on the whole time. And so that's pretty phenomenal. We are going to have another one, another panel, and next one will be on October 9th, Friday, October 9th. As a part of what we're calling our Shakedown Weekend for Throwing Bones. And again, the education component is how we learn to do this better. And having these conversations and having healthcare providers as well as individuals living with cancer ask questions because that's the viewpoint that all of us need in order to make this better. I promise to continue to use small words, but thank you very much. Carly, do we have any more questions that you can think of, or we think we kind of nailed that?
I think we did it. We got all the questions answered.
Awesome.
We did have one comment for Sandy and Bree about compiling the references that you guys used during your time. And so we'll get those out as quickly as we can. Awesome. To the people in attendance.
Awesome. All right. And as a last thing, if anybody needs to reach out, please feel free to, I'll leave it up to the individual panelists if they want to make their information available for contact or follow-up questions. I'm personally happy to answer anything else. You can go to throwing-bones.org if you have any of those sorts of questions, and then just let me know. My 7-year-old is trying to FaceTime me at the same time at the end of the call. So,
thanks, everybody.
Thanks, y'all. Have a great day.